This podcast, a simple summary of a scientific peer-reviewed paper, is made with the help of AI by Big Head Pain, Dr. Faradoon Hagdoost. Today's episode covers the powerful and human-centered paper, Cluster Headache versus Labor, a comparative perspective on acute pain during and after delivery, by Judy Sharaf and Ashar Ali, published in Headache, the Journal of Head and Face Pain in 2025. This brief communication offers more than clinical data. It shares stories of two women who experienced both cluster headache and labor pain within days of each other. It's a rare and revealing comparison between what is often described as the worst kind of headache and one of the most intense forms of physical pain known to humans, childbirth. The first patient, a 30-year-old woman, experienced a full-blown cluster headache attack in the emergency department while in early labor. She had a second attack after her first push in the delivery room, and both times she self-injected sumatriptan despite staff hesitation, aborting the attacks. Importantly, she did not use any pain relief like an epidural during labor. After delivery, when reflecting on her experience, she clearly stated that the cluster headache pain was far worse than labor. In her words, it was overwhelming to endure both the worst pains in her life simultaneously. The second patient, 28 years old, made a striking choice. After learning that cluster headache is often considered more painful than labor, she decided to forgo an epidural just to see for herself. 5 days after giving birth, her cluster cycle returned. Comparing the two, she didn't hesitate. She'd rather give birth 16 times in one day than face another attack. That kind of clarity, grounded in lived experience, adds a visceral truth to the commonly repeated idea that cluster headache is the worst pain imaginable. What makes this paper remarkable isn't just the pain ratings, it's the timing. Because both patients had cluster attacks in the same period as childbirth, their comparisons were less influenced by memory distortion or recall bias. They weren't thinking back years later, they were living it in real time. And they were brutally honest. There's also a deeper emotional layer here. The authors describe how labor is usually a time of support, preparation, and family gathering. Cluster headache, on the other hand, barges in without warning, offers no sympathy, and leaves only after wreaking havoc. It doesn't care if you're pregnant, postpartum, or sleep deprived. It arrives uninvited, like a cruel and stubborn guest. And when it comes during childbirth or the fragile days after, it creates a unique emotional burden that few can truly grasp. This paper doesn't claim to settle the pain debate once and for all, but it powerfully illustrates the immense suffering cluster headache brings, even in life's most defining and demanding moments. These are not just pain stories. They are stories of resilience, frustration, and raw human strength.